Hi everyone, I'm Kevin Lamoureux, and for the past year I've been the assistant principal at the Woonsocket Area Career and Tech Center.
I'm Charmaine Webster. I'm a Woonsocket Boys and Girls Club volunteer, a Woonsocket Health Equity Zone resident ambassador, and a Thunder Miss peer navigator coordinator.
And joining us today we have Dr. Jeanne Ziter, who is a pediatrician at Thunder Miss in Woonsocket.
Thank you. Happy to be here.
Happy to have you.
Thank you for coming. COVID-19 vaccines have recently been made available to children as young as 12 years old. Is this vaccine really safe for our kids?
It's a great question, and it's the one that all parents are struggling with, right? And I can tell you that this vaccine has been studied in over 2,200 children and found to be safe and effective.
Dr. Ziter, working in a school, something that's really important to me is how do we know that it's safe for our kids to return to school in full capacity?
Sure. We all want to get our kids back to summer camp and school. This has been a tough year for them, and I worry about their physical health, their mental health, emotional health. So we do want to get them back to their normal activities. It's going to be safe for kids to get back when the most of them are vaccinated.
And now kids do have a strong immune system, and I know that I've heard that they might not necessarily be susceptible to COVID-19. Do they actually need the vaccine?
Another great question that I hear a lot. So you're right that children and young adults do have good immune systems. However, they do get COVID, and they can get sick from COVID. They usually have a milder case than older adults and the elderly, but they can get sick.
So not only are there questions about the vaccine being safe, but I'm getting a lot of questions and, have concerns for my own family about how the vaccine actually affects our children.
And I understand because I'm a parent and I have a daughter and a son, so I think about these things as well. But this is a question that we get often, and I can tell you that there is no evidence, no research, no findings that indicate that the COVID vaccine causes any interference with fertility. You may have heard recently that there have been an increase in cases of something called myocarditis, which is some inflammation of the heart muscle, or or pericarditis, which is some inflammation of the sac around the heart. And we have seen a increased incidence of that, particularly in young men, like 16 to 30. 1 in 50,000 young men in that age group could get that side effect, okay? So if you think about it, if you have a whole stadium of young men of that age, all of which are vaccinated, two in that stadium will have that side effect. Usually symptoms are mild, and usually they're transient and they go away.
Okay. And so let's say that I'm a parent of, an older teen or a young adult, and I decided that I would like to have my family vaccinated, but my teen or young adult are on the fence. Would you be willing to take an appointment just to have conversations with the child?
Absolutely, right. We want people to have the information. We want them to have the facts. We want them to be able to have their questions answered. Mm-hmm. Everybody deserves that, and we're very happy to do that. And I think you can reassure your children when they come in that bring your questions. Mm-hmm. The provider just wants to listen. See what your concerns are, what you've read. And then we will share the facts. We'll share the facts, and then you can take them home and think about them. If you're comfortable that day, you can get the vaccine. If you want to go home and think about it some more, do a little bit more research, we can direct you to sites that have strong scientific facts. Mm-hmm. I think it's a great idea.
Thank you very much for joining us today. This information is so valuable. We really do appreciate having you.
To learn more, please visit c19vaccineri.org or call 401-222-8022.